Hi, Dr. Powden. This video will serve as my reflection and my action plan for next semester. So as I begin, I'd like to say that I felt it was a really good semester for me. I felt that I learned a ton and I grew as both a clinician and a student in the past semester. So I'm extremely proud of the progress I've made, but I also know, as we'll see in a minute, that more progress needs to be made. So I think I'll start with my clinical goals. My clinical goals were to utilize at least 2 patient-rated outcome scores and to help better my practice. And when it comes to that, I not only feel that I don't know if I would have done it on my own. Let me say it that way. I think having your implementation plan as well as having this goal really urged me to move forward. And I was very, very skeptical at the beginning of the semester. Throughout the entire outcomes assessment class over the summer, I was extremely skeptical. But now I've utilized the GROC and I've utilized the lower extremity functional scale as my 2 main ones, and I've even utilized the visual analog scale, and I kind of love them, and I'm no longer skeptical because a lot of times my patients they don't want to be held out. So what they do instead is they just oh, I'm feeling fine. But for some reason, when they have it on a piece of paper, they're able to they're like, oh, actually I do have difficulty with this. Oh, I do have a difficulty with that. And then it helps me as a clinician to target those specific areas. So I never realized that they would be an asset that I was missing, but they really are extremely helpful. And I think that moving forward into next semester, for this specific plan, is I want to utilize them. I want to utilize a new one. I want to utilize an upper extremity one. Maybe I couldn't even think of one off the top of my head, but I know that there's a lot of them out there. And so maybe an upper extremity one, because I do have a lot of shoulder injuries right now in basketball, which I didn't think I was going to see, but I am. And so my action plan for next semester is to utilize 1 upper extremity as well as those 2. So that way I have an upper, lower, and 2 kind of generalized whole body outcome tools that I have and I have experience with before I move into my second year. My second clinical goal was to utilize cupping on at least 5 patients. And I was a little nervous about that because I was like, 5 patients, that's a lot of patients. But definitely did. Definitely did. I have seen the results of cupping and they blow my mind. I knew it worked. I've seen the results, but I've never done it myself. I never saw myself doing them and causing the bruising on accident. But having that experience has been really, really cool for me. I've used it on a shoulder patient and with an impingement patient, tightness causing that impingement. And by the end of the treatment, she has no pain because, of course, you've loosened everything up. And so that little relief just makes the world of difference for her. And the fact that we get to do that is awesome. And then my other patients, I use it on a hamstring girl, and although that has been a little difficult because I think it's just such a big muscle, and so I'm having a harder time with that one. But the more we do it, the more experience I'm getting. I'm realizing that you can use cupping and then use grafted along with it, or use cupping and use stretching. So I'm getting better at those techniques. So those are just 2 examples of people that I've used them on. I've used them on calves, I've used them on backs, I've used them on scapulothoracic musculature, and I've just really seen the benefits of it. So I'm really pleased that as I go into next semester, I know I'll continue to use that. Now, when I look at my academic goals, those are a little trickier for me. My main goal was to maintain my 3.0. And I did that. And that's the exciting thing about it, is that I feel like this semester was so much better for me academically, and I've really focused on it, and I worked really, really hard, and I made a lot of sacrifices. But I think going in the DAT weekend, I am so much more prepared, and not even with grades, but with knowledge. I feel that I'm able to really, participate and learn as opposed to just being worried about how I'm doing. My second goal was to understand the research process, which we've learned is not a good way to word it. But I think this semester in research has really been helpful, and it has been really difficult. I really don't I didn't like learning about the research project, this process. But now I do know that there's qualitative, quantitative. I know there's quasi. I know there's observational. I know there's educational. All those things I didn't really realize I knew, which is extremely exciting for me. So those are just really big pluses. So those are my two. That was my academic and my clinical. And I think when it comes to my research as well, is I wanted to do my research on ATs, physically disabled athletic trainers. And although that's still kind of in the back of my mind, I don't know if the prevalence or the importance is big enough to make a research project on. So progress has stopped for that, and I think it's just because I've become discouraged because, there's no mentor here, and maybe I'm just thinking too big and too broad or making something a bigger deal than it is, but I think that it really does go along with the LGBTQ study that Ashley, Emma, and Sean are doing, because it's looking at the way people perceive someone that's different than you, and I think having that physically disabled athletic trainer and finding out how people view them as professionals, I think it's someplace that we can definitely go into in the future, but it's going to take a lot of work to get there. And I think that if I don't have a mentor, I'm going to need more experience. So right now, I have not had any progress. And the second one I had was to do a manuscript, or not a manuscript, but the commentary on a systematic review, which we did over the summer, and I failed at. And I've had no motivation for that. I was really discouraged in last semester, and I think that it really inhibited my desire to do it again because I know how difficult it was. So with that said, I think that progress has stopped for that reason, and I'm not proud to say it either. I don't like quitting or anything, but right now I have no desire to do it. And I'm focused on my research project, I'm focused on the immediates, and that's something that probably should change. So now that we've kind of gone over a lot of what I wanted to do and how I've achieved them, I think my action plans for next semester is going to be extremely important to me. Like we discussed just at the beginning there, for the pros, I want to utilize an upper extremity shoulder or upper extremity in general patient-rated outcome score. I think that will really aid in having a library of tools that I can use once I graduate, and especially going into my second year so I can improve as a clinician. My second goal is to use or get more experience with cupping. I think that having that Graston certification, I think will go really well hand in hand, but I think the more I practice cupping, the better it's going to get. So I don't have any actionable plans for that because I think that that's just going to come with experience and using it more and finding the benefits, and I think every time that I do it, I get more and more better idea of what I need to do and how I need to do it. And so, or what can be better for my patient. When it comes to academic, I need, now that I've done this semester and I've focused on that 3.0 and I'm focused on maintaining it and going into DAT weekend much stronger, I definitely did this to balance better. I feel like my clinical experience is not as important as my academics this semester because I was so focused on staying in the program. So next semester, it goes along hand in hand with cupping and the pros, but I want to focus more on my clinicals, and I don't want to have to feel like I need to be perfect to maintain my GPA. So once I get into a better spot, my action plan for next semester is to focus on my patients, especially going into in-season basketball, and to still set aside good time for my academics, but not to let it inhibit the care I give to my patients because I feel like I don't have time for them. That's something that I really need to work on, and that'll come with balancing better, hopefully making more treatment times available to them, as well as working more ahead on my projects now, or in the beginning of the semester, so that when it comes to, well, I guess now it's going to be in-season basketball, and then it's going to be off-season, so maybe waiting until basketball season's over to really delve into those long-term projects. I think when it comes to my research proposal, I'm going to put the AT on the back burner. I think that that's where it needs to be, and I want to focus on the ankle. I've realized throughout my studies that this is my passion. I love the ankle. I've always loved the ankle, but I always thought it was because it was easy. You could always diagnose it. But as I look into chronic ankle instability and look at my presentation that I'm coming into doing tomorrow. I'm really, really excited for what I'm going to find out with this, and I want to continue learning about it. It's very interesting to me. I'm super excited. So I think going into next semester, I want to have that IRB. I want to have the IRB submitted. I want to start with doing a pilot study. I want to start with get recruiting, and those are my goals. Is to make sure, like, I want to do all my data collection next semester, and that is going to be like my main thing. Is I really want that's my action plan for tomorrow, or for next semester, excuse me. And then the last would be the commentary for the Journal of Athletic Training, and I should have an action plan for that, but I don't. I don't know if I'm going to have time, and that sounds horrible, and that sounds like an excuse. But that's what this is about, right? Metacognition or whatever, thinking about your thinking, and my thinking is saying I don't have time. But hopefully when basketball season ends and I get into next semester, I can really focus on it once I get more research under my belt. And those all might be excuses, but my action plan for next semester is, like by April, having an article chosen. So those are my goals. I think, again, that the semester went really well. I have so much to learn, but I feel that I have learned so much, and I'm really excited about where I'm going to be next year and where I'm going to be next semester. So, thank you, Dr. Powden.